Hi, I'm Frank Spear. I'm recording this video actually to share with you that I'm going to be back in Denmark again this June. You know, I've had the greatest experience of having spent 4 out of the last 5 years. I've been there for 2 days each time, and the audience has always been great. The food's great. I love being in Copenhagen. And so I'm going to be coming back for the 5th time in 6 years this June. In past years, we've talked about a number of different topics, from occlusion, worn dentition, integrating minimally invasive techniques into more complex cases. Last year, we talked about interdisciplinary aesthetics and creating interdisciplinary treatment plans. And this year, we're going to be doing something that I think will resonate with virtually all clinicians, is we're going to talk about clinical failures. And clinical failures are, one of the more frustrating things that we deal with in practice. And, if it's somebody else's failure, it's not quite as hard on you. But if it's your own failure on your own patient, that's a whole different story. So we're going to walk through basically how to predict the highest risk patients for failure, how to potentially prevent failure in those patients, and then how to manage failures if they do occur. And we're going to talk about patients with simple clinical issues all the way to patients with more complex clinical issues. We're going to basically be addressing the same content for all of them. How do you predict it? How do you prevent it? How do you manage it if it happens? And, a big part of it is going to be talking about something I like to call, is it a real failure or is it a perceived failure? There's a significant difference. And so a real failure, you and I all know, is the porcelain fractures. That's a real failure. A perceived failure is we do something and somehow the patient is not happy with the results. And yet we look at it, and when we evaluate it, it seems fine to us. And so we're going to spend a fair amount of time initially talking about the differences between real and perceived failures and how you talk to patients to minimize the risk of having them. We're going to break it down into talking about aesthetic failures, functional failures. So we're going to talk about who are the high-risk patients occlusally at risk of failure, and how would you change their occlusion to minimize that risk. And we're going to talk about structural failure. Structural failure is failure of either teeth or restorations. And again, how do we minimize that risk? And then we're going to talk about biologic failures. And biologic failures could be pulpal, they could be soft tissue, they could be bone. And so we're going to cover all of those topics, but we're basically going to have the same theme throughout, which is what's a real failure, what's a perceived failure, how can I manage it in advance to minimize the risk of happening in my office. And so I'm really looking forward to coming back again. We've always done it in October before, so it's going to be fun to be there for me in June. And I hope to see you all there. Thank you.